Hi, Professor Tracy. My name is Nidia Apostle. This is the class Bio 230. This is the lab 8 where we're doing the cow eye dissection. So a couple of things that we're gonna need is going to be our water with bleach, with 9 cups of water with a cup of bleach. We need the paper towels, we need our gloves, we need the disposable protector mask, we need our kit dissection and our goggles. Of course, you gotta wear some clothes that you can go ahead and throw away if something happened, your apron, and we're gonna begin with the eye dissection. So today we're doing the cow dissection, and let's begin by looking at some external anatomy of the cow. Let's start with the outermost structure and the interior structure. This is the cornea. And there's not, in the cow, of course, this will be clear like glass, but since this eye has been preserved in the back, is denatured the protein and it looks a little bit cloudy. Around that, you see a lot of periorbital fat of the connective tissue too. This connective tissue and fat helps the eye because it's connected in an orbit. And if you turn your head quick and did not have this fat, it will hurt and damage your eye. So the delicate part of the eye will be hurt. Now let's look to the posterior of the eye. You see this long tube structure coming out of the back of the eye. This is the optic nerve, and that goes straight to the brain. Some of the other structures are this brown material right here. See that brown material here, here, and pieces here, and here where it's being cut. See all this brown material? That's the eye muscles, and that helps the eye to move up, down, side, and so on. So let's begin to remove the periorbital fat. So I'm gonna get the scissors, and I'm gonna attempt to put the fat that is extra so we can clean up the eye so we can see things a little bit better. It's a little bit catchy to do this, but start to look better. So let's take a look. Remove this fat. It may take a minute, but it looks more clean. You can see that the fat is disappearing from the sides, allowing us to see a little bit more. Wow, I think that looks a little bit better. We don't have around too much fat, and we can see the optic much better. Just a few minutes. Let's gonna start with the internal dissection, and we're gonna go ahead and do this posterior to the cornea. There is another layer that is called the sclera. So let me hold the eye and let's see how I can. The sclera usually is really tough to cut, but we're gonna hold this handle well. I'm gonna put my hands around it so it's secure, and let's be sure that you don't have your fingers, and let's go ahead and do it into the cornea. So you can touch and you can feel the liquid or like a jelly substance, and it helps to shape the cornea and maintain the internal shape of the eye. So we're gonna take a look at that. When I cut, you're gonna see that the liquid is gonna come up, and the liquid is called aqueous humor. And this liquid helps to maintain the shape of the eye, so it's not wrinkles in the eye. So let's go ahead and push down. It's hard. See how the liquid is coming? That's it. Careful with your fingers. Keep rolling in circles. You can see all the aqueous humor right there. Keep going in circle. And I'm trying to not to disturb the destruction inside of the eye, so we can show you the parts of the eye. So let's take a look of the posterior end. Let me see, all the liquid is out. That's the aqueous humor. And if you see the jelly material, that's the aqueous humor. That's different. And so gently, I'm gonna get the vitreous humor and put it out. It's like jelly material. See all the jelly material? So you can see clearly the parts of the eye. And I just see this green material here. That's the retina. And this material probably is the most important of the eye, as it contains the photoreceptions and detects the incoming light. Now as I move this material, see? But you see that it's going to be a stop to the eye in certain corner, which is right there. And see, what it keeps the retina pressed to the eye is the vitreous humor. The vitreous humor is gonna press the retina inside of the eye, and the vitreous humor is basically out. When we take it out, we can go ahead and take this and bunch it out. And it comes really easy, except in one place, which is right there in the middle. See how it's attached? See? That's the one place where it's attached. And that is basically the axon of the nerves of the retina. All the axons of the eyes of the retina pass through to the back of the eye, and when they pass through, see, so refer to the optic disc. So we also call it blind spot. So you can see that. And if you see in the back, and if you see in the back of your disc, this is attached to the optic nerve. So that's where they exit and go to the brain. And let's go back to the eye. That's the retina. And the worst part that you see, this metallic, I don't know if you can see it here, metallic color. Now, but this is only in the animals. Humans doesn't have this part. There. You know, this is just like animals that are active at night and they need to see at night in clearly or very early in the morning. And it helps them to see better at night and reflects additional light as they need it. Let me go ahead and dry a little bit the liquid so we can continue dissection without interruptions. Okay, so this is only for animals, so we were talking about. The choroid is under if we remove it. So this, the black color of the choroid, it absorbs light. So when the lights come in the eye, and it goes straight to the retina, and it helps to pass all through the nerves and it gives you the ability to absorb the light and transform it through the nerves. Under the choroid is going to be a thick white corner. You're gonna see how thick is, and you can see the thick layer right here. That thick layer is the sclera. See? Tough material right there. And that's the sclera. So let's go and see the anterior part of the eye. And in the anterior part of the eye, let's dry very well the vitreous humor. And I want to take all the jelly. The vitreous humor is like jelly constitution. And I'm going to dump so we can kind of appreciate better the inside of the eye that we're talking about. So the jelly-like material, see, is out. So now the first structure is the little gumball shape here. That's the lens of the eye. And it's responsible for extra change shape, focus the light, and place it properly in the back of the eye. So you can see this lens should be a little bit more clear like a glass, but since we have preservation, well, it's a little bit foggy. But if the person will be alive, this will be soft and had a lot of proteins that will avoid to look cloudy like it looks like right now. Now, take a look at the black spots here, or surrounders that it is. That's the lens. See? Now you see the striations, like the ciliary body, right there, and attached to the lens. And it's responsible to change the shape of the lens. Like if you see far away, so the ciliary will help accordingly to do that. Also, I'm gonna go ahead and remove the lens. Trying to remove this. There we go. So the suspensor ligaments are the ones that are basically attaching this. Look and see, here's the suspensor ligaments. So see, I'm gonna go ahead and remove the lens. Look at that. There, it's completely out. That's the lens. And let's take a look at additional structures. So let me go ahead and see how these little lines here, ciliary body, and then the smoother black structure. I'm gonna try to grab that, but let me, and that's called the iris. And the iris job is to allow less or more light. So the iris is going to change the shape, and it's gonna allow to the pupil to become larger or smaller in the iris. So you can see how the pupil work when dilate or help you to minimize depending of the light. So now see that is the cornea that we were looking at, the hard part of the eye. So that's gonna be the structure of the eye. And one more thing I wanna finalize with, and that it is If we cut this one and put it back in the eye, see? And that's can call interior cavity, and posterior out is called the posterior, where the vitreous humor was. So that's gonna be it, the dissection for the cow of the eye of the cow. We see the vitreous humor, we see the cornea, we see the sclera, and the iris and lens of the eye. Thank you for watching. Until the next video.